Are you experiencing irregular periods, unwanted hair growth, or acne that just won't quit? You might be dealing with polycystic ovary syndrome or PCOS. This hormonal imbalance can be a real pain, but recognizing the signs is the first step to taking control. PCOS is a metabolic and hormonal disorder that affects about 10% of women. You'd think that with a name like polycystic ovary syndrome, the condition would mean that women have cysts on their ovaries. But that's not always the case. According to the Endocrine Society, a PCOS diagnosis requires the presence of 2 out of 3 specific criteria: excess androgen levels, irregular periods, and polycystic ovaries. Unfortunately, half of women with PCOS remain undiagnosed. So now, let's talk about the signs and symptoms of PCOS that you should look out for. Stick around to learn how to recognize the warning signs and take control of your health. Number 1. Irregular periods. PCOS can really mess with your period. Because your body isn't making enough progesterone, your cycle can become all wonky. Instead of a regular 28-day cycle, you might go for weeks or even months without a period. This is known as an irregular period, or oligomenorrhea in medical terms. And when you do bleed, it might be super heavy or super light, leading to a really unpredictable menstrual cycle. Number 2. Infertility. PCOS can make getting pregnant a real challenge. In fact, it's one of the leading reasons why some women have trouble conceiving. The issue is that PCOS can disrupt ovulation, the time when your body releases an egg. Even if you're getting your period, it doesn't necessarily mean you're ovulating, so you might not catch on to the problem until you've been trying to get pregnant for a while. Number 3. Hirsutism, hair loss, and acne. Because PCOS messes with your hormones, you might start growing hair where you don't want it. This extra hair can pop up on your face, arms, back, or even your toes. It's not cool, we know. Studies show that women with PCOS and hairy places are also more likely to have other health problems. So, if you're noticing unwanted hair, it's a good idea to talk to your doctor. Number 4. Fatigue. Many women with PCOS struggle with feeling exhausted. One reason could be sleep apnea, which is more common in women with PCOS. Sleep apnea means you stop breathing for short periods during sleep, which can make you feel super tired during the day. Not getting enough good sleep can also make mood problems worse. Number 5. Mood disorders. It's not uncommon for women with PCOS to feel down or anxious. Studies show that people with PCOS are more likely to deal with depression, anxiety, and body image issues. This might be because of the physical changes that come with PCOS. It's important to talk to your doctor about how you're feeling, both physically and mentally. They can help you find ways to cope. Number 6. Insulin resistance. Insulin is like a key that unlocks your cells to let in sugar for energy. When your body doesn't respond well to insulin, it's called insulin resistance. This is a common problem for women with PCOS. In fact, most women with PCOS have it. Insulin resistance can cause other issues too. You might notice dark patches of skin, especially in your armpits, groin, or neck. This is called acanthosis nigricans. It's a sign that your body isn't using insulin correctly. And remember, insulin resistance is also linked to type 2 diabetes, so it's important to keep an eye on it. Number 7. Weight gain. Half of women with PCOS struggle with unexpected weight gain. Insulin resistance, as we discussed earlier, is a common issue with PCOS and can mess with your body's ability to process sugar and fat, leading to those extra pounds sneaking up on you. Hormonal imbalances can also affect how fat is distributed. However, it's important to remember that not all women with PCOS will gain weight. The best approach is to focus on your overall health and well-being, rather than letting the scale dictate your mood. Think you might have PCOS? Talk to your doctor. It's always best to get checked out early. Not only will it help you figure out what's going on and find some relief, but it can also help prevent bigger problems down the road. PCOS can increase your risk of health conditions like diabetes and heart disease, so getting an early diagnosis can help you take steps to stay healthy. Plus, if you're thinking about having kids, knowing about PCOS can help you plan ahead. If you found this video helpful, give it a thumbs up and share it with someone who might benefit. Don't forget to subscribe for more tips on women's health. Thanks for watching. See you in the next one.